My name is Dr. Ahmed. You are welcome once again to my channel. I will be talking to you today about cervical cancer. The cervix is simply the entrance into the womb, as you can see. When there is cancer of this entrance into the womb, we call it cervical cancer, which is overgrowth of the cells around that area. Cervical cancer is the fourth most common cancer globally in women, and it is highly preventable with regular screening and vaccination. In fact, it is almost entirely preventable with screening and vaccination, and it is common in low and middle income countries due to the fact that there is reduction in the rate at which we are vaccinated. What are the symptoms of cervical cancer? Cervical cancer is quite common between the range of 30 to 50 years, and it usually presents with abnormal bleeding from the vagina, or when there is abnormal discharge, either watery or bloody, and also pelvic pain, paralyzed body weakness, loss of appetite, and dizziness. Lastly, people with cervical cancer can also experience pain while having sexual intercourse. What are the things that put us at risk of having cervical cancer? They can either be modifiable, which are things that we can control, or non-modifiable, which are things that we cannot control. The modifiable ones, first is human papilloma virus. This is a virus that is quite common in women as a result of sexual intercourse. It's the most common cause of cervical cancer in 95% of the cases. So people that have this virus are predisposed to having cervical cancer because this virus changes the cells around the entrance of the womb. So what are the things that can put people at risk of contracting human papilloma virus? Having multiple sexual partners. Then having many children can also put people at risk. Smoking, having sex at any age in life, usually before the age of 18 years, also puts people at risk of having cervical cancer. People that have been using oral contraceptives for more than 5 years are also at risk of having cervical cancer. Then obesity. People that are overweight are also at risk of having cervical cancer. What are the things that we cannot control? First is age. It's quite common between the ages of 30 to 50 years. And also, having family history of cervical cancer or any form of cancer like breast cancer. Lastly is gene. There are some genes in our body which, when present, can change and cause cervical cancer. How do we prevent cervical cancer? To get vaccinated against human papilloma virus. This is a virus that has been shown to cause 95% of cervical cancer. It is encouraged for young girls between the ages of 9 to 14 years to get vaccinated, or older adults. And also, both boys and girls are encouraged to get vaccinated. Boys can also have this virus and they can easily transfer it to the girls. And secondly is regular screening. Usually, women of reproductive age group from ages of 25 years that have started giving birth to children should get screened. So the screening method is what we call pap smear. When you go to the hospital, they will tell you more about how to do a pap smear and when to do it. Thirdly is to limit alcohol intake, avoid smoking, ensure regular and balanced diets, to take a lot of fruits and vegetables. And lastly is to practice safe sex. Having multiple sexual partners puts you at risk of having cervical cancer. So when you practice safe sex, by that I mean use of condom, it is going to reduce your chances of having cervical cancer, as it has been shown that this virus can be gotten from men. So men can easily transfer the virus from them to the women. Thank you for listening to me today. Kindly like and share, comment, and also follow me on all my social media accounts.